Support for WMFE comes from JustCallMo.com and attorney Mo DeWitt. As a Central Florida native, Mo DeWitt is committed to offering legal guidance in personal injury cases such as car accidents and slip and falls. Offices in Orlando. More at JustCallMo.com. Welcome to Engage, leading conversations that matter. Engage is made possible with the support of inaugural sponsor, JustCallMo.com, and the support of listeners like you.
You're listening to Engage on 90.7 WMFE. I'm Sharon Stone. Coming up, we will look at the racial disparities in medical diagnosis and why women of color can be susceptible to subpar medical care. And we'll take a less than academic analysis of the legendary and often viral Florida man. First, though, President Biden signed Senator Rick Scott's bipartisan End Fentanyl Act into law last week to combat the opioid epidemic. This law requires Border Protection to review and update its inspection policies to root out drug smuggling at the border. Fentanyl is on the radar of Central Florida law enforcement, too. Law enforcement officials in Volusia County issued a warning in Daytona Beach last week to spring breakers about the dangers of the opioid. Fentanyl is also showing up in other drugs, dealers using it as a cutting agent, creating a deadly cocktail for unwitting customers. I asked Bob Nixoporowitz, a 30-year veteran of the DEA, if he had ever seen a scheduled narcotic as deadly as fentanyl.
No. When we talk about the impact of drugs, I was a DEA agent for 30 years, and I saw firsthand how it devastated communities, neighborhoods, families. People were dying, people got addicted, and we have never seen a threat like we're seeing now. And just to give you an idea, nationwide, what we're facing, what has happened over the last several years, and it's been increasing for more than that. We have lost tens and tens of thousands more people. Just an example, 2023, last year, in the United States, we lost over 112,000 people to drug overdose deaths and poisonings. And if you look at that, so that number puts it in context, that's over 300 people average per day. And imagine a plane crashing every single day and losing 300 people. That's the impact of what drugs are doing. And the majority of those deaths are related to fentanyl.
Bob Nixoporowitz isn't just speaking to us as a former Drug Enforcement Agency agent. His son died from an opioid overdose in 2017. Bob is working with the Volusia Recovery Alliance now to save lives by stopping overdose deaths. Their executive director, Karen Shrapek, and Bob joined Engage to share their experiences and solutions.
And as DEA, our mission was to dismantle transnational criminal organizations, drug trafficking organizations around the world that were putting poison on our streets. And I saw this firsthand. But to be honest with you, the saddest and most frustrating part of my life was losing my own son, Justin. He died in 2017 of a heroin overdose. And when I talk about that, I think back and I see this beautiful boy that was very happy. We went through some struggles and had challenges like every family. He had a lot of medical issues. He was a risk taker. He was just a beautiful young boy. He was doing good in school. And around sixth grade, I started to see some changes, and we just started dealing with some issues. We were going to counseling. We were trying to deal with the issues as they came. He started drinking alcohol, smoking marijuana, experimenting with pills. I think he was self-medicating, trying to deal with some issues. And after a while, I woke up one day and discovered that he was addicted to heroin. And what I realized was all the training, all the experience, all the information I had as a DEA agent, and as I'm working on the streets trying to curb this problem and stem the flow of drugs, I couldn't keep drugs out of my own house. And we then started trying to get my son some help. The same day I put him in treatment. Got him in treatment, and that was a time where he struggled for years. And what I saw was firsthand, I knew about addiction as a DEA agent. I knew that it was physical, psychological, but I had no idea of the extent of it, the impact of it, of how strong it was to hijack your brain, the grip it took on Justin. And I saw that in so many other people that were struggling with a substance use disorder, because it is a disorder. And we were struggling with him and struggled for years, but he was in and out of treatment, in recovery houses, at least 50 of them. We were going to counseling, trying to deal with this problem and get him help and get him to sober. And Justin, throughout these years, overdosed 10 times that I know of. And his 10th was his final. He died on the streets of Kensington in Philadelphia in 2017. The same streets that we as DEA and our law enforcement partners were working, trying to keep it safe for the public. And I can't describe to you the frustration and sadness that I felt and my family felt. I am in no way a victim, never will be a victim. I'm a grieving father. And I can tell you that I've spoken to so many families that have lost kids or lost loved ones, and so many families that are struggling and that are in fear of getting the worst phone call of their life, that after a while I knew I was going to get, I just didn't know when. And when you get it, you are crushed. And I got to tell you, there's no closure. Because what happens is you always have that void, and what you do is you try to work through it.
As a father who has lost a child to this, what is your number one piece of advice to parents?
Talk to your kids as much as you can, educate them, understand that you can't control everything they do. Everyone will make mistakes and poor choices. We all do. But hopefully they make them reinforce healthy choices and give them the support they need. And last but not least, what I would say to any family that's out there that has someone that's struggling, never, ever, ever lose hope. And recovery is always there. And recovery works. It's not easy, but never lose hope. If they fall 100 times, pick them up. I'm not saying to enable. It's very difficult between enabling and helping when you're a family member. It's very difficult to differentiate that. But pick them up. I don't care how many times. We're all human. We all make mistakes. Never lose hope.
And Karen, you told me that you've been in recovery for more than 40 years. Help us understand why this addiction to fentanyl is so difficult. What do you hear from people in recovery who have used this?
That it's the best high they've ever had. So, there's a lot of things that lead me back to gratitude for my recovery. And this is a case of one of those things, right? When Flacca was in the state of Florida, it's a stimulant. I was a stimulant user. I didn't use heroin, although I did have a prescription for Percocets because I had chronic pain, and I got that from a doctor. But the substance that I like to use was stimulants, and I drank. And so when stuff like this comes out, I step back and I say, I'm so grateful that I got into recovery when I did, because I know I would be using the same things that are killing people. and I want to live today. I love my life. I have a life beyond my wildest dreams because of my recovery. But I know that if I wasn't in recovery for so long and I wasn't so committed to my recovery and to maintaining my foundation in it, that I wouldn't be sitting here.
So, Karen, can we talk a bit about the severity of the problem in Volusia County and what you see?
We see a lot of people return to use at times, and then there's the whole people end up using for the first time, sometimes as an experiment, sometimes from peer pressure, as Bob mentioned. But, there's still a lot of people that are first-time users. What I can tell you is that we did have 238 deaths from overdose last year in Volusia County alone, and a lot more overdoses that didn't result in death. So it's definitely still prevalent here. I believe that Volusia County is in the top 5 of counties that have an overdose problem. And Florida in general is number 2 in the country for overdose deaths, just behind California. So it's a prevalent problem throughout Florida. Some of it is because, we have a lot of people that come here on vacation. The numbers just swell, especially during spring break. There was a press conference last week with Attorney General Ashley Moody that really talked about the dangers of drugs on the street during spring break especially. And the flip side of that is that even though there's still quite a few deaths here, the numbers have gone down. The trend is going down by more than 20%. A lot of that has to do with Volusia Recovery Alliance and other organizations throughout Volusia really have been pushing Narcan. We do a lot of overdose reversal and response training with free Narcan distribution. And I'm happy to say, since we started our contract with the Department of Children and Families towards the end of 2021, that VRA alone has given out more than 18,000 Narcan kits. We've trained well over 7,000 people on how to use it. We have hosted more than 548 training sessions. And the good thing is that we've gotten reports back from the community that our Narcan has resulted in 197 reversals. So that's 197 people that got a second chance of life and a chance at recovery.
Karen, how does Narcan address the problem?
When you use an opioid, you have opioid receptors in your brain, and the opioid sits on top of those receptors, and then it affects, the person's breathing and all that because of where those are in the brain, right? It's in the areas that controls breathing and other life functions. And Narcan swoops in and knocks that opioid basically off the receptor so that the body can return to its normal physiological function. The problem is that you must call 911 when you give it because it doesn't last for a really long time. And depending on how much opioids are in the person's system, they're going to end up back on that opioid receptor. And then the process of the person's breathing is going to be diminished until they're not breathing. So when we give out Narcan, we typically give out at least 4 kits, which is 8 doses, because it can take more Narcan to get the person breathing again if they have a lot of fentanyl in their body. It's not enabling to save somebody's life with Narcan, but that's a myth that's out there. So kind of, squashing some of the myths that, come along with harm reduction, but really also making a commitment to reduce stigma because language matters. We don't talk about people being junkies. That's very derogatory. Language really matters. And so, I say I'm a person in long-term recovery. And using person-centered language helps, right? Not pointing the finger, not being judgmental, understanding that it is a brain disease.
Is there a difference in how someone would recover from fentanyl addiction compared to other drugs?
I believe that the tools are essentially the same. People that use meth often take a longer time to recover because meth really causes a huge dopamine push through the brain. And then, without getting into a lot of brain chemistry, that drug really forces a bigger boost of dopamine. And then when you take away the drug, the person really feels terrible because they've lost their ability to produce in their brain normal amounts of dopamine. And it takes longer for the brain to heal. Our brains do have neuroplasticity and they can heal, but some drugs, it takes longer for those neurotransmitters to kind of even out and heal your brain. So, the first year is the most critical with people in recovery. They need a lot of wraparound services. They need a lot of support. And so we try to provide that, especially for people in early recovery.
That was former DEA agent Bob Nixop Horowitz, who lost his son to an overdose, and Karen Shrapek with the Volusia Recovery Alliance. There is more ahead here on 90.7 WMFE's Engage, and we are streaming live now on WMFE.org, and that's where you can find this show as a podcast and listen at your convenience. You're listening to Engage on 90.7 WMFE. I'm Sharon Stone. Ahead on this program, the Florida man meme is a popular, if not hackneyed, internet trope, and poet Tyler Gillespie heard the call to explain the phenomenon.
I went to the University of New Orleans, and people even there were asking me, what's up with Florida? So when you're in a bar in New Orleans and a Texan's asking you what's up with Florida, you kind of need to figure it out as a Floridian.
Gillespie joins us to talk about gators, growing up queer, and the legendary Florida man. First, though, the Florida Hospital Association projects a physician shortage of more than 35,000 by 2035. When it comes to doctors from underrepresented groups, the problem is worse. A 2022 report from the Association of American Medical Colleges shows that just about 7% of medical doctors identify as Hispanic, just under 6% identify as Black. UCF medical student Hannah Wilson is trying to address the shortage by introducing high school students to medical careers. The U.S. Department of Health and Human Services just recognized her work by giving her the Excellence in Public Health Service Award. Wilson is a mentor with the Medical Enrichment for Diverse Students program that targets Orlando high schools with low-income students. And she joined Engage to talk about increasing representation among minorities.
As a high school student myself, I went to an underprivileged high school, didn't have a lot of funding, and I didn't know a lot about medicine. My mom was a nurse practitioner, and that's the closest thing I knew to medicine. I would be the first doctor in my family. And so I felt like I didn't have a lot of resources available to me, and I learned in college. And even when I stepped into college, I already felt like I was so behind during my first day as a freshman. So I just kind of wanted to pay it forward to other students who may feel like or be in a similar position and kind of show them the ropes and just mentor them and give them access to medicine to see if this is even what they want to do or spark that interest and things like that. So that's kind of why I wanted to do it.
Do you think that the number of Black students in medicine is representative of the Black population?
No, I think that there is a lot of improvement that can be done in that area. And that's with Black students, Hispanic students, Native American students, all minorities. And I feel like this program was one way that I feel like I can help tackle that in my own way.
Help us understand how that lack of diversity among physicians is affecting care in Florida.
Yeah, so I think with minority communities, and this is proven with a lot of research, that there's just a big mistrust. And a lot of that stems from, like I said, past clinical trials and how minorities have been treated within the medical system, and how a lot of our issues are may not listened to or taken as seriously, such as our pain level. Like, I think there's articles, some physicians may believe that, oh, Black people handle pain better than their white counterparts, which is totally not true. So I just think that with that big mistrust, stepping into the room or having the doctor that looks like you, it's already like one level of trust established, and you already feel more comfortable to tell your story, and even feel more comfortable that this physician has your best interest and you want to comply with whatever regimen that they are prescribing you. So I think it is a lot of issues, but one of the biggest issues I see personally is a big mistrust within the healthcare system.
On the flip side, what do you see happening if you can get those numbers up in terms of representation?
Yeah, I feel like if we can get just more doctors in general in these areas of where minority patients live, we can have early diagnosis of things. So many minority patients present later in the course of their disease, and a lot of times are more unhealthy because of that. So if we can even get more doctors in where they live, they can get to see doctors early. So just increasing their access to medicine to increase their overall well-being and healthiness, like getting treated earlier, having the preventative medicine that they need so that they are not presenting later along in their course and less likely to survive. So I think that's a big one way, increasing access, and then just having that access be someone they can trust.
Can you share a story maybe about a student that you worked with that really stands out to you, or that maybe you really enjoyed working with, and tell us why?
Yeah, I think from during my first year in meds, it was one high school student. He was a senior, so he was really about to start his journey. And during the meds program, really transformed he kind of knew he wanted to go in medicine, which is why he became a part of the meds program with Elevate. But just seeing how he really was like, just had so much more motivation to do this, and was like, wow, I could really do this. I really enjoy doing this. We did a birthing simulation of taking like birthing a baby. And he was just so in awe of everything, along with all of the other students. But being that he was in his senior year, we were all able to talk to him more about, okay, this is like the courses you should do, that you could, how your major works, like just giving him the overall ropes of college. And I felt like you can see the direct outcome and the direct benefit of the program. And it just felt very rewarding. And to have him go out into college and kind of know what he's doing. We even set him up with doctors he could shadow at Orlando Health and Advent Health in the community. So just giving him access to those resources, like I said, that are so limited in these areas, is just like you see the direct benefit of the program working, and you can see the need for the program. And that's always rewarding to know that what you're doing is actually helping someone.
Hannah, will you tell me about what inspired you to go into medicine?
Yeah, so growing up, my dad had colon cancer, and I was 1 year old. He was originally given 9 months to live. And like I mentioned earlier, my mom was a nurse practitioner, and he ended up living 9 years. And I felt like, being that my mom was kind of like his advocate, like a knowledgeable advocate who knew about the healthcare system and knew how to navigate the healthcare system and kind of be there for him, advocate for him. And I feel like that's why he had a fairly good prognosis, giving the 9 months versus living 9 years. And that inspired me to want to be an advocate for my patients and wanted to be that person that they, like their knowledgeable ally, to help them navigate the medical system.
And talk to me about that journey that you're on. You're a third year doctor?
Yes, I'm currently almost done with my third year. We're towards the end of it, so rising fourth year very soon.
Help us understand how long of a process that is and just what's next for you.
Yeah, very, very long process that is all still continuing. So I completed 4 years of college or undergrad at the University of Florida. And then I applied. I took the MCAT. I took one gap year in between ending undergrad and starting medical school. And that during that time, I was a medical assistant to try to get more engagement with the medical system, to know that this is really what I want to do. And then I applied for med school. I got into UCF. My sister also went to UCF undergrad, so it was nice being close to her. And I've just been trucking along now. It goes by so fast. I can't believe I'm already at the end of my third year. It's been a crazy journey, but definitely being involved with the programs I am involved in has helped kind of make this more fulfilling, not only for myself, but also helping the community.
How did it feel getting the award?
surgery is such a hard rotation. It's notoriously one of the hardest rotations that we do. So just getting that news while, you're kind of not really feeling too confident in yourself and just going through those like imposter syndrome, getting that award just felt all the more worth it, especially during this time. So I cried. I was like, whoa, oh my gosh. I was so happy that like I said, they didn't tell me that they nominated me for it. It was all a surprise to me. So it felt really rewarding.
Tell me a bit more about some of the other programs that you were involved with that you found satisfying. One that stood out to me was the Bleeding with Dignity project at UCF.
Yes, yes. So at UCF, we have a health equity scholars program and where you make a project and you apply for funding. And so my project that I created and I applied for under the program was the period project Bleeding with Dignity. So I have a huge passion for women's health. I want to be an OBGYN. And so I wanted to create this project in order to kind of do my goal at tackling the period poverty issue through this funding that we were awarded. I gathered a bunch of students who were also interested in the cause, and we put together period kits, and then we distributed to our 5 student-run free clinics that we have at UCF College of Medicine, and then we also distributed them to a women's and children's shelter in Orlando.
Can you tell us a bit more about that period poverty that you mentioned?
Yeah, so I think that just talking about your period in general is a very big like taboo. It's like, oh, we can't talk about that in public. And so because of that stigma, a lot of women do not get the access that they need to clean menstrual products. Like, for example, in the bathrooms, we even have to pay for a tampon, pay for a pad. Sometimes you're in the bathroom, like, trying to be silent to open your pad. And it's like, we all are women. We all go through this. Why is it so scary to talk about? And so because it's so scary to talk about, I feel like women are not as easy to speak up that these are things that they need. And so just giving them access to those products, whether even if it's just for this one time, it's just, someone is there knowing that this is an issue and that you can give access to clean menstrual products. I think that's really important.
Hannah Wilson is a UCF medical student recognized for her work addressing healthcare disparities in her community. Now, a women's health forum is being held this week in Kissimmee called Why Don't They Listen to Me? It addresses the unique challenges women of color face in healthcare. The Black Empowerment and Community Council is one of the hosts. The president and co-founder, Tiffany Jeffers, joined Engage to share how the upcoming open dialogue will address the challenges.
We are seeking equity with our Black and Brown women, specifically Black women in the health arena. There is a disparity that shows us that most times when we go to the ER or we're delivering our babies, that, they say, oh, Black women's pain tolerance is at a higher level than any other race. And so sometimes when we say we need help or this is a condition, these are the symptoms that we're experiencing, sometimes we aren't heard. And I know for me personally, that was my experience delivering my first baby. I was left in labor for hours and hours and hours. And I was explaining to the nurses and the staff that I was in horrible pain. And unfortunately, it ended with me having an emergency C-section that could have been avoided altogether if someone had come and listened and just understood what I was feeling and taken my symptoms seriously.
Why do you think that is? Why do so many women have that feeling that they are ignored?
I honestly, I don't know if it's just ingrained in our culture or society, or if it's systemic. But it's definitely something that we want to dive into in our conversation and see, why is that? Why do we have to raise our voices so loud when others don't have to? I think about my husband and, when he goes to the doctors, for instance, he went this weekend and he said his back hurt and they didn't check him. They just kind of took his word for it and said, okay, let's give you this medication. And I remember going into the doctor for a similar thing, and it's just question after question after question. And so I'm hoping that through this talk, we can really discover what are those differences and what we can do to make that change for the better.
We're talking to Tiffany Jeffers with the Black Empowerment and Community Council. So do you envision having doctors and medical experts there to speak to some of the unique health challenges minority women face? Can you tell us more about what some of those challenges can be in addition to your experience? You lived it.
Yeah, so some of our challenges can also be access to quality health care. Some of our lower income women don't have access to quality health care. They may not see their primary doctor as often as they should because of financial reasons or just being afraid to go to the doctor again because they don't know whether or not they're going to be listened to. They don't know if they walk out, if they'll have a tremendous bill. And so what I definitely want to talk about is having our people not self-diagnose, really going and seeking care, but also having those resources. We want to share resources for free clinics. We want to share resources for doctors who are attentive and have that quality bedside manner where they can build a relationship with their patient and understand what they need and begin to start to see things happening in their bodies before it becomes too late.
Do you envision this as something for women who maybe need to seek care participate in, or would you like to see community leaders addressing more systemic policy issues?
I'd actually like to see both.
Both.
I think we have to have a well-rounded conversation. And I feel like you have to address the systemic part, but you also have to address some of the mindset of our community and some of the awareness of what resources are available and try to get them to a place where they understand that they're cared for and that there are medical experts out there who have the resources to care for them in a way that is well-rounded, and it's not just where they're going to be a number or let's just get you in and out of my office in 15 minutes. So I'm hoping that we can have a really in-depth conversation about the holistic approach to social justice and in healthcare.
And Tiffany, what is your message to women who are feeling ignored, or maybe they're too scared, or maybe just too busy to do something about their health?
Yeah, I can definitely relate to the too busy part. We only get one life, and so many people depend on us. And sometimes that can cause us to even be afraid to go and seek care because you don't want to get some news that might tell you you need to slow down or you need to really take an aggressive form of care for what you're dealing with. But I would like for everyone in attendance to know the importance of making sure that you're living a full and healthy life. And that begins with going to your primary care, asking those questions, knowing what is in your family history, and not being afraid to just take a moment and really develop self-care and really taking care of your health is self-care. And we want to be here and enjoy life. And you can only do that if you're healthy and well.
Tiffany Jeffers is the founder of the Black Empowerment and Community Council, and that free Women's Health Justice Forum is Thursday evening from 6 to 7:30 at Solid Rock Community Church in Kissimmee. Coming up, the Florida Man explained by a Florida man. You are listening to Engage 90.7 WMFE, and we want to engage with you. Send us an email to engage@wmfe.org, or you can send us a talkback on the free WMFE app. You're listening to Engage on 90.7 WMFE. I'm Sharon Stone. The Florida Man trope has become as ubiquitous to the identity of the Sunshine State as alligators in the House of Mouse. Poet and comedian Tyler Gillespie has chosen to embrace the irony of Florida man worship. As a queer fifth-generation Floridian, he carries the bona fides to both acknowledge the culture of his community and mock with affection rather than derision. Gillespie captures the essence of the caricature from the perspective of the state's LGBTQ+ communities in Florida Man, Poems Revisited. That's an updated re-release of his 2018 collection of poetry. The book is one part primer of the ludicrous Florida stereotype, one part family history and guideline for being queer in Florida, and one part a love letter to his favorite Florida native, the alligator.
Bag of sugar-sized muscle pumps blood. Most reptiles, 3-chambered heart, but gator, 4 chambers, like mammals and birds, which gators used to be millions of years ago when they were dinosaurs. Over time, wings went missing, can't fly no more. Alligator males grow over 12 feet. Florida record, 14 foot, 3.5 inches found in Brevard County. His heart must keep strong. Animals depend on Gator to stay alive. In dry season, he uses mouth and claws to clear roots and marsh, beats tail, and creates mud burrow, a gator hole. Cold-blooded, depression helps him stay warm. Hole fills with rain and fresh water drunk by snakes, insects, turtles, and birds, long-lost gator cousins. Heart makes him dangerous, of course, but maybe under scales, thick set of armor, he still feels wings. Remembers a time he flew so free next to clouds.
When he's not writing poetry, Gillespie is an instructor at the Ringling College of Art and Design. He joined Engage to talk about his poetry and Florida Man, and he started the discussion with his definition of the Florida Man.
So I think there's like Florida Man with a capital M, and that's someone who has been subject of one of the headlines that kind of have been viral over the past few years. And I think a Florida man with a lowercase m is folks from Florida who are kind of just living here and grappling with those kind of identities.
You first published the Florida Man poems in 2018, and we've got kind of an update with some newly written work that was just published this month. What caused you to do the update?
So I started writing Florida Man in grad school. I went to the University of New Orleans, and people even there were asking me what's up with Florida. So when you're in a bar in New Orleans and a Texan's asking you what's up with Florida, you kind of like need to figure it out as a Floridian. So I started writing about it my last kind of year of school, and then I moved back to Florida to be closer to my family. And then that's when the Pulse shooting happened in June. So I was writing essays, and then after that happened, I recovered that for publication, and then I stopped writing the essays because I didn't really have any answers about Florida. And then I started writing the poems because they let me ask questions and not have to have any answers. At least that's how I was writing the essays and the poetry. And so then that was published in 2018 by a small press. And essentially what happened is there was one print run and it became really hard to get, essentially out of print. And people would ask for the book, like bookstores. And I did a reading here in St. Pete, and a bookstore was asking me for it. And essentially that's kind of what put me in contact with the publisher who was interested in republishing it, because Florida Man has not left the zeitgeist, even though he just won't go away, it seems. So I've reissued it. And then, of course, with the new issue, he was like, do you want to add 10 poems or something? And I was like, what about 20? So
Why not?
Why not? That's what I did.
You mentioned that it allowed you to ask some questions. What kind of questions are you still asking yourself?
So about how the different layers of Florida, it's not one thing, it's not one place. And that's what a lot of writers and a lot of people that live here talk about. There's no such thing as one Florida. There are many different Floridas and many different lenses to view the state. There are different issues in South Florida as in Central Florida, North Florida, and they have different histories. Though we all have a similar history, but there are different realities. So I think that's kind of what I've been thinking a lot of, and especially the kind of the joy that I find here, the community, like my family, my friends, but also the sadness and the kind of real difficulties that people face living in this state, including, people that I care deeply about.
You speak about or write about a lot of serious topics, the environment, history, culture, and you identify as a gay man. I'm wondering, how do you navigate these serious issues within your writing? You told me before we started talking, you consider yourself a recovering comedian. Is that evident in your writing?
So a lot of the poetry and a lot of my writing does have an element of humor in it, because I think that that is a really effective strategy to talk about difficult topics, to have a little bit of levity, to get kind of circle into a tough topic. But that's how life is, right? There's never just sadness. I mean, it may feel like sadness or grief is the thing that is the most present on our tongue, but there's always other things on our taste buds, right? So I think that that's what humor lets us do, is say, yes, there is sadness, but there's also joy. yes, there is rain, but there's also sunshine, right? All of that. So there is humor. And then as a recovering comedian, and as someone who's in literal recovery from substances, which I do talk about in the book, you have to just laugh. And that's what my grandma always said too. Like, you have to laugh to keep from crying. And I think, like, also, we're living in a heavy time, not just in the state, but post pandemic, financial stuff, environmental stuff. So I think a lot of us want to laugh, and that's sustainable to also continue these conversations.
Something I wondered always about people who take a comedic route for their careers. How do you know when it's appropriate to go somewhere with a topic? Like, is it too soon after something happens, or is there a healing element to it to approach it with humor?
Well, I do say I'm a recovering comedian because that's a question. Like, I'm not the best, but for me, I think sitting with something that's important that I've thought a lot about, and I mean, obviously, a lot of the stuff doesn't get on the page. So there's a poem in the book that people point to when they're talking about the humor. It's called "The Sky is Gay, I Don't Make the Rules," and it's in that poem. It's talking about I was driving home and I saw the rainbow, and then I saw like the colors of the trans flag, like pink, blue, and white, and I was like, the sky is gay, And then through that, then we're able to talk about how the state has like legislated against LGBTQ communities. So that's kind of a moment where it's like the humor with the title, but then it gets into talking about some of the realities, but then also it ends on a note of hope. So I think for me, it's just something that I've sat with for a long time that I can then find a bit of humor in. But I definitely think after something tragic happens, we shouldn't be making jokes, at least for me. Maybe other people will have a better approach to that, but not for me.
As I'm listening to you, I'm wondering if the writing is for you, is it therapeutic, or are your words a message to your audience?
I think that writing has started as a personal endeavor when I was younger, but now I think much more about audience, especially when, for example, there's a poem in there about the state of Florida canceling prides in certain cities, or like, certain cities having to cancel prides last summer because of the real threats. And I was asked to write that poem for the St. Pete Pride, which is a really big pride here in the state. So they asked me to write a poem for their pride guide. And, in that moment, it felt very heavy because prides were getting shut down and people were scared and worried and leaving Florida. LGBTQ members didn't feel safe. So there, it's like I specifically have to think about audience in my community and the people I care about. And, in that moment, it was for LGBTQ Floridians. But for me, I'm just like, the Floridians that live here, like my book is really for folks that live here, folks that care about the state, and folks that want to see what's going to happen in the country, because Florida so often predicts a lot of, or like is a barometer for what's going to happen. So that's kind of the audience that I'm writing to.
We've talked about some heavy topics just in this short interview. How does that weigh on you as a teacher as well?
That's a great question because so where I teach at a private college and we're in Sarasota that's near New College. So it's that thing where what's happening at an institution near me is affecting people that I know. I know professors there, and a lot of my students know students there, right? So it's this balance of having the ability to talk about tough things with the students, giving them space to do that, and then also trying to come back to a place of resiliency and hope, because that's the thing that I personally am trying to lean into is the hope that we have here in the state. Because sometimes I think we get so caught up in this like big narrative of what's happening and then the headlines, but a lot of the people that I know that live here, we're figuring out ways to make our communities better and to come together and collaborate and just to like live and survive, you know what I mean? So I try to do that with the people I'm in community with as well as my students. But they care a lot about those issues, of course, because they're younger and they're like, should I stay here? How do I make a life for me in the state?
And Tyler, going back to your book, Florida Man Poems, and the new release of it, I noticed within the book itself the literal page structure. Some of the words were just kind of upside down and written in different non-traditional ways. So what is the message in the arrangement of the words?
Yes. So going back to reissue it, I also got to update some of the original poems and some of the formatting, right? I asked the publisher of Borough Press, which is an iconic Florida publisher, can I put a poem upside down? Can I do this landscape? And he was like, sure. And so, for example, there's a poem that mentions the butterfly ballot. And so you have to turn the book because then it mimics like what a butterfly ballot would have looked like essentially. And I also like the idea of having to turn the book to slow down the reading. So the readers will have to take a pause. And then towards the end, there's also some QR codes that go to sound poetry. Some alligators, mating calls in there, which makes sense if you're reading the book, maybe not just hearing this, but if you read it. So I really wanted to think about that embodied experience of reading. And I also like the idea of like turning the book is essentially like making a circle or like kind of like a hurricane kind of is in my associative brain of what's happening. And the upside down poem is also like thinking about the state turned upside down. And so they have connections to the themes of the poem.
And Tyler, what's the takeaway for our audience?
The takeaway for me is that I've always loved this state. And I think that there's so much going on in this state that we can't get good things, that we can't get distracted by all the negative. We need to look it right in the eye and then figure out what we can do about it. And the way for me to do that is by writing, having a little bit of humor, but also touching on these more serious topics.
That was Tyler Gillespie, author of Florida Man Poems Revisited. His book is now available from Borough Press. That is all for today's edition of Engage. We'll be back Thursday at 3 o'clock. You can learn more about today's program by visiting our website, WMFE.org, and that is where you can find the Engage podcast and listen when it's convenient for you. Just a reminder, we do want to hear from you. Let us know what you'd like to hear more about or what you're glad you heard. Send us an email to engage@WMFE.org or send us a talkback on the free WMFE app. Thank you for joining us. I'm Sharon Stone. All Things Considered is coming up following NPR News.